We first implemented ThoroughCare at the inception of our business in 2021. It gave us the confidence that we could run a business and successfully run a business and manage patients. My background comes from a short stay working in the hospital on surgical floor. And then I worked in home health care in many different facets and decided I didn't want to work in the corporate world any longer and decided to go to my husband and say, hey, Ben, I want to start a chronic care management company. And he said, let's do it. Here in South Central Texas, we have some clinics. They may be a lower income clinic. Some of them don't even have hospitals in their town. One town only has one urgent care. So we definitely service a population of patients that could use that continuation of care. Through working through home health, I developed relationships with physicians who trusted me. So when I said, this is what I'm doing and this is what we're doing, they signed on and they were ready to do it. And it has been the best partnerships with the best patients. And then having a wonderful partnership with ThoroughCare, we look forward to being multi-state at some point because of all the great referrals that we get and the conversations that we get to have with being such a strong partner with you guys.
ThoroughCare as a whole, as well as analytics, is done to help us is to be able to grow our business more than double in the last 12 months. I don't think that's something that's manageable without a good software program to guide you through it.
There were some chronic care management companies or practices trying to do chronic care management when we put together and developed 2G. What I was hearing, moreover, was that they weren't getting the revenue. So that was one thing I was looking for when we did partner with ThoroughCare, is to be able to go deeper and show them that there is revenue to be collected, that there is a better way to do it than just through their typical EHR. And so that was one of the things that I saw that was definitely missing in there. Our main providers get into ThoroughCare. I mean, they actively go in, they look, they can't do that from their EHRs. They can't see how many patients are actually on CCM, PCM, RPM. Those things are not easily obtainable. I love that EHRs think that they're CCM worthy, but let's be honest, they're not. ThoroughCare was built for this and it's perfect for it. We're heaviest in the CCM application. We're also using the PCM application. We use the RPM application, and we also use the analytics portion very heavily.
The analytics piece allows us to determine some metrics and use those metrics with our staff to set goals and to really drill down to what is most meaningful to the patients and really improve our efficiency on how we manage those patients. To be able to pull those reports daily has been a real help for us to be able to kind of measure as we go through the month where we stand. It's near real-time data. Currently, we provide all of our physicians that we partner with a monthly summary of everything that's been done as far as billing, time, specific codes, and we use analytics to generate those reports that we provide. Without analytics, it would be a very manual process that would be nearly impossible to do. Specifically, we use the billing and claims worksheets probably the most. Those allow us to really dive into the data of what has occurred over the previous month as far as specific patient cases, specific claims, as well as being able to break things down by provider, what patients are seeing which provider, and actually measure which providers are having more patients and more success through the program.
Our partnership with ThoroughCare is just, it's unbelievable. One of the things we want to work on this year is CGM, the continuous glucose monitoring. And that's really going to help our diabetic patients. And I know that if I bring that issue to the table, that you guys will do everything you can to educate me on what you guys already have and what you're willing to do to help us to improve that.
It's the same relationship that we try to have with our providers is that we have with ThoroughCare, is that partnership. ThoroughCare can't be successful if we're not successful. We can't be successful if ThoroughCare is not successful. So rather than a standard vendor-client relationship, it's a partnership and we're working together.
One thing that, ThoroughCare always does is y'all's ears are always open and you're always willing to help in any way to help us to be better to take care of patients.